So lots of questions about the cost of dental implants. So what affects the cost?
Listen, there's a lot of things that can affect it, and we'll go through a list. I have my little paper here to be able to answer that. But the first thing, listen, the implant. We all buy the implants. We all got the same thing. You can buy a dental implant as cheap as $65. You can buy an implant as expensive as $800. The question is, what is it that's the difference? You know, at the end of the day, the implant needs to stay in your head. The implant needs to be able to heal. And not only that, it needs to stay there for a very, very long time. In my practice, we use the best, the most researched implants, and I can see what's happening long term because we follow these cases, and they do unbelievably. And that's one thing.
So when I see ads on Google for like $9.95, it's possible they're only quoting the cost of that little tiny
That's
implant.
correct. That's correct.
Misleading in your opinion?
I think so. Bait and switch.
Okay.
Because at the end of the day, everybody buys the implants the same price. You know, so
there's
we
more
go from
to
there.
it. What else affects the cost?
The other thing is that, you know, typically what happens is there is more than one doctor that's involved. There'd be the surgeon, there'd be the restorative doctor, there'd be the lab technician, and you know, everybody has to eat, and you have to pay all of those people. In my practice, I'm the doctor, I'm the surgeon, I'm the restorative doctor, and I'm the lab technician. So I do everything in-house. We have our own CNC machines that make this, we have our own printers that make this. Everything is done in-house.
When you say printers, like a digital printer that makes the teeth?
Like a 3D printer that will create your teeth from nothing. And that's in-house. You don't have to wait. You don't have to wait for the lab. Everything is done there. And because we do everything there, we could control the costs and we could pass that savings on to you.
Is that why you do it so quickly? Because you've got this in-house lab?
That's correct. Everything is done very, very quickly, very, very efficiently, and very, very successfully. The next thing that affects the cost is, do you have bone? How big is your mouth? How many implants do you need? What type of specific parts do you need on top? All of that built into the cost. Remember, when we do implant dentistry for our patients, it's customized. It's not like, say, all on 4. Everybody just gets 4 implants. Some people need 8 implants. Some people need 6 implants. Some people just need 4 implants. And on top of that, some people may need extra bone. Some people may need specific type of implants. All of this built into what the cost is actually going to be. But then, so we did the surgery, we chose the implants. Now the other thing that affects the cost of the implants is the technology involved. Is your dentist putting that goop in your mouth? Is he telling you, hey, you got to come back in 2 weeks because I got to go send it out to who knows where for them to do something, and then when it comes back it doesn't fit? All this technology that is being used, we use digital technology. We use an actual video camera to take a picture of your mouth, to take a picture of your implants. Everything is on the computer. We can save it for years. We can replicate it. We can change things to the point where if I put your teeth in your mouth and you say to me, Dr. John, something is not the way I like it. How do I fix it? What do? We put you through a 3D facial scanner. We now take your face onto a computer and we can rotate it in every angle, zoom in on it, measure it to make sure that your smile is exactly perfect for your face. That's unbelievable. That's technology costs money. The other thing is people say, well, what about my insurance? Does my insurance cover it?
What does insurance cover?
So if you think about the problem is that they equate dental insurance with medical insurance. Yes, Medicare, Medicaid, people think that they have it. It's really nice, but it doesn't cover dental implants. People say some medical insurance will cover dental implants. Good luck with that. It just almost never happens. Dental insurance, if you're lucky, you have a $2,000 maximum. And guess what? If you have that $1,500 or that $2,000, we'll try and get it for you. You'll get that check in the mail from your dental insurance. But it just doesn't cover all of the dentistry because this is major dentistry. And unfortunately, in this country, dental insurance or medical insurance does not cover dental implants, period. Just not covered.
But you say people finance?
Yeah, so what happens is that people say, well, how am I going to pay for this? Well, it's quite simple. You got good credit. You have a friend that has good credit. You have a family member that has good credit. We can finance up to 100% to give you easy monthly payment plans.
Do you have in-house people that do this for them?
So my treatment coordinator will sit down with you. We'll apply for you within 30 seconds. We'll know if you're approved for it. You can even call on the phone and we can do it for you before you come in to see if you're approved, and you can help us. You can give us your friends' information if they need that, and we can get you approved so that you know before you even come in if you can be applied for financing. If you don't need financing,
about 90% are financing this?
95%.
Not just in your office, across the country?
I think so.
Okay. What else affects the cost?
So the other thing is, sometimes people say, well, I saw on the internet that it's only X dollars. It's so cheap and you're so much more money. What does that mean? I always tell them that the material that they're using is extremely important. So maybe they're using some sort of plastic material, and you walk out and you're like, wow, I got a great deal. And then you go out with your friends and you bite down in that piece of pizza or you eat that burger and boom, your teeth explode. How scary is that? You go back to your dentist and your dentist says, oh, no, that was for the cheaper teeth. That was the temporary teeth. And they didn't tell you that when they gave it to you. Us, we use zirconia. It's extremely strong. It's the strongest material. You can take a car, drive over it, and it won't break. And for those that even have stronger teeth, we take zirconia and we mesh it with titanium to be even stronger. And you can go through anything. So
what the final teeth are made out of plays a huge role in how much it's going to cost.
Huge role. It's not just the implants, it's the type of teeth that go on top of it. And there's so many variations, it's extremely important to pick that.
So the cheaper ones just don't last as long? Is that why you don't do it?
That's correct.
And they don't look as good?
They definitely don't look as good. Because imagine, it's like with porcelain, with zirconia, we can recreate natural teeth. The translucency, the color, everything, so that nobody will ever say, because the biggest fear is people will know they had it done. Because they've been hiding their teeth their whole life.
Okay.
Right? And we want to make sure that we give them, oh, all of a sudden you decided to smile? Yeah, I was shy before, now I just smile. And be like, oh, you look great. I never want my patients to walk around in public and say, hey, nice dental implants. And then you know it's a failure.
Okay.
All right. Last thing. People say, oh, well, I got my implants. And I said, okay, great. And how does it feel? Well, it's good till I take them out at night. And I say, who? And they get what's called snap-in, snap-out dentures.
You don't like these snap-in, snap-out?
I don't like, cost of permanent teeth have gone down so much that you can get the same price as permanent teeth that you would spend on snap-in, snap-out dentures. Snap-in, snap-out dentures, the implants fail more. They don't feel as comfortable. They're
It's
obviously
still a denture, right?
Still a denture, still big and bulky. Food still gets stuck under it. It's just not right. If you're going to do this, do it right and do it once.
Is this something that the new guys, new dentists do when they're breaking into the business? Because I hear a lot about these snap-in, snap-outs.
Yeah.
Is it easier to do? Is that why?
It's very easy to do because they can place the implants whichever way they want, crooked, straight, whatever. The denture covers all of the work, and the patient just deals with it. But in reality, it's just too big. We want to give them back teeth. That's why with zirconia and titanium, we now can give them teeth that look real, that feel real, that they can chomp into anything they want and never have to worry about their teeth coming out.
And just like your regular teeth, these can last a lifetime, right?
If you take care of them, they can last a lifetime. Absolutely. And then most importantly, it's the experience of the doctor. You can go to someone and they'll say, oh, it's so much cheaper. But God forbid you needed a heart replaced. Would you go to the cheapest surgeon or would you go to the best? If you needed a heart valve, would you ask for the cheapest heart valve or would you ask for the best? And this is exactly the same thing. This is something that you never want to go cheap. You don't have to spend exorbitant.
Cut corners.
Yeah,
right?
cut corners.
Because you could do it cheap as well.
That's correct.
We talked about this.
But
in the
we
green
don't
room.
want to cut corners. We don't want to make sure that they get this done once and they never have to do this again.
And it's not even that much more to do it right.
It's just not.
Right?
Yeah, that's correct. Because we control all the costs, it's extremely affordable for what we give them and the service that we give them and the quality that we give them and the attention and the post-attention. A lot of places they'll do your teeth and then they'll send you on your way. You'll never see them again. I've been in business for 20 years. We follow you through. When your teeth are finished, it's not over. You now go into your maintenance program. You visit us every 3 to 4 months, so we make sure that everything is under control so that you have success. At the end of the day, people say, we're going to call the office. And the first question they always ask is, how much is it? And I always tell them, listen, you can have a starting price of what it could actually be. It could be above or below that. But at the end of the day, no matter where you go, you need to meet the doctor.
You need to be seen.
You need to be seen. This is, we need to see your CT scan. We need to see your photos. We need to see your expectations. We need to see if you're healthy. All of this comes in. If an office just tells you this is what it is, be very wary because things always change. And that's the last thing you want is a surprise when you get this done. Come in for a consultation. We'll spend the time with you. We'll educate you. We'll show you everything that needs to be done, how it should be done, how long it's going to take without any surprises. And I tell you, you won't be disappointed.
If you had an opening on your schedule, they're watching this, they come in today, let's say in the morning, they could have their upper and lower teeth tomorrow. I know that's not how you typically do it, but could you do it in 2 days, 2 visits?
I could probably do it if they came in the morning and I had an opening in the afternoon, I could do it in the afternoon.
Really? That fast?
Because we have the technology, because of my inventions, because of my process. this is the way dentistry should be done. If your dentist says, oh, I need 2 weeks, I need 3 weeks, I need a month, they probably don't do this every day.
So experience matters.
Experience.
This is a big, I mean, you lecture on this, right?
We lecture, we teach internationally, we teach doctors how to do this. This is not a joke. Come to the people that invented this, come to the people that do this every single day, and do it the way it's supposed to be done.
And, you know, I know, and we've talked at length of this, the public doesn't know the difference, right? Is that part of your frustration? That,
Yes.
you know, that the experience matters so much in this type of...
It's everything. When I do my case, you are my walking billboard. And I will never, ever let you leave unless I am proud of what I put in your mouth and how gorgeous you look and how amazing you feel. And we will obsess about it until the solution is reached.
I have to bring this up because you brought it up in our green room. You said that because you're teaching other dentists across the country implant dentistry, and you ask them, I'm paraphrasing you, but you said you'll ask them about their work and they say, yeah, it was okay or something like that?
Yeah, so I asked them, so what do you think of your case? And they say, I should have done better. I should have been more meticulous. I should have done this instead in hindsight, but the patient was happy. That's unacceptable. When a patient comes to us, they are now telling us we are the experts. We trust you. I trust you, doctor. Do what needs to be done. And I will make sure that if it was my own mouth, that's what I put in your mouth so that it looks beautiful.
So patients, just because they're happy,
That's not success. Because what happens is when they're happy, but the doctor's not happy, that means something will go wrong in the future.
And you see a lot of that going on.
I see it all the time. People come back, they say, hey, I started the implant case. I have an implant coming out this way. I have an implant in my sinus. I have an implant that is not in the right position. I have an implant that lost bone, right? They use the cheaper implants, right? They didn't do it correctly. They didn't have the technology to place the implants. They didn't use the right materials. They have food stuck in there. And then 2 to 3 years down the road, everything goes in the wrong direction because whether the doctor was inexperienced or the patient looked for the cheapest doctor, this is not a procedure that you want to look for the least expensive doctor. You want to find the most experienced doctor, the doctor that does this every single day so that it will be there for a very long time.
But I think we need to put this into context. When you say not the cheapest, but it's just like
it's not that big of a difference.
It's like a little bit more.
Yeah,
and you're saying that they're using cheaper implants that may only cost them $100 less.
Maybe $25 total. You'd be surprised.
So there's a lot of cutting corners.
Ton.
But they're not doing it intentionally. Do you think?
I hope not.
Do you think they just don't get it?
I think
if I have to put you on the spot here, do you think, because you train other dentists, do you think they don't realize the importance of quality materials, things like that?
I think that, you know, dentists are businessmen and they're scientists. And sometimes I think that the business part of it takes over the science. And they say, well, how am I going to cut corners to save money, to be more profitable? And the patient just doesn't realize that because they don't equate a doctor being a businessman. At the end of the day, you can tell based on the work, based on the longevity of the work, based on how long someone's been in business, based on how long they're experienced, based on if they're teachers, if they're educators, if they're inventors like I am, if they're the right person to do this. You know, I don't care if you come to me or you don't. I would love to treat you. I'd be honored to treat you.
Okay.
But if you choose a doctor, make sure you ask the right questions. How many have you done? What type of implants are you placing? How long is it going to take? How long is my work going to last? Do you have cases that have been this long? Have you done a case just like mine? There are so many questions that you can ask that you should ask because this is a big deal. You know, we make it sound really easy, but this is a big deal. When everything goes right, great. But when it goes sideways, you don't want to be the one on the receiving end of that. So at the end of the day, don't look for the cheapest doctor. Look for what's affordable, but more importantly, look for someone that has all of the things that I listed in this video.